Gold viewers from around the world. I'm Kristen Schwartz, licensed midwife and MC for Gold Learning. And I'm here today with Liz Stokes, and we're talking about her upcoming presentation, Balancing Beneficence and Prevention of Harm when Caring for Pregnant Women with Substance Use Disorder. Welcome, Liz.
Thank you so much. Happy to be here.
Thank you for coming in. This is a very, very important topic, balancing the benefits and prevention of harm when caring for pregnant women with substance use disorders, and especially now that we're living in a time where we are in an opioid epidemic here in the United States. And I want to talk about your topic, but before we get there, tell us a little bit about yourself and your professional journey and your background.
Sure. I am a registered nurse, and I started out as a registered nurse and worked for many years in the intensive care unit, as well as cardiac and coronary care units. And that's been the basis for my specialty work and nursing practice at the bedside. I recognize there were many difficult moral and ethical dilemmas in nursing, and I wanted to expand my knowledge and education in trying to figure out how to deal with these complicated issues. So after I spent many years in the intensive care, I decided to return to school, and I actually got my law degree, so I'm an attorney as well. And through my work and through my legal journey, I've learned a lot about ethics. I've learned a lot about specifically bioethics. And I also got my master's in bioethics. I wanted to know a little bit more. And that has taken me into a wonderful career. I say I have 3 titles, a nurse, attorney, and an ethicist. So I get to work with patients, I get to work with nurses and families, and try to help people figure out these difficult ethical and moral challenges.
What a wonderful background, Liz. You are a nurse, a lawyer, and a ethicist. That is fantastic. I don't think I've ever met anybody with that round of a background. That
It was
is,
a long one.
I'm sure it was a very long journey, but here you are, and we are the ones, we are benefiting from all the knowledge that you have here, our delegates and us, of course. And I can't wait for this presentation here when you're talking about caring for pregnant women with substance use disorders, especially in the times we live in now. And coming to that topic, I can imagine it's issue of health. It's health concerns. It is, of course, legal
Yes.
concerns as well, and ethics concerns. So this fits right into your field. So tell us a little bit more about the presentation and why it's so important.
Sure, and that's exactly right. And so in my practice, especially as a bedside nurse, working in the intensive care and working in many different settings, nurses and healthcare providers interact with pregnant women who have substance use disorder, whether it's alcohol use disorder or whether it's some type of opioid or any other illicit substance. Nurses really are challenged morally in treating these women, especially because they know the negative effects that can happen to their child or to their fetus. And so just the treatment and care of these patients, who are often patients who we might see again for the same or similar issues, nurses really struggle with how to care for them, as well as how to care for the infant once it's born. So children and infants that have neonatal abstinence syndrome or fetal alcohol syndrome really challenge nurses, and we know from the research and science that it can absolutely cause moral distress in these nurses. So this is an important issue. And as you mentioned, especially in light of the opioid crisis right now, it's important for nurses to know the ethical obligations to care for both the mother and the child, as well as to know the legal implications wherever you're practicing.
You brought up a very important point. Yes, you're right. As nurses and midwives and care providers, we're caring for, the pregnant woman. But there's also another life involved here, the baby's life, of
Correct.
course. So this is very important, not only for the mother we are caring for, the woman we're caring for, but also for the baby. So,
Correct.
and there's absolutely so much to learn here. And I'm glad you brought up also the care provider, because you mentioned this can be also very hard on the care provider, or difficult as well, caring for mothers with substance use disorders. So I'm looking very much forward to learning so much in this presentation. So before I let you go, Liz, can you let our listeners know a little bit what you like them to take away from it?
Sure, absolutely. My goal and the takeaway from this presentation is to actually learn more. So, to learn more about substance use disorder and what's involved and how it affects the mother, as well as learning the emotional aspects of caring for infants who have NAS, neonatal abstinence, or fetal alcohol syndrome, as well as looking at the ethical obligations of the healthcare provider and what providers should do to provide compassionate and transparent care for the mother and everyone involved, as well as look at ways to help treat the family and treat the unit and provide specific recommendations for these families and communities.
Well, Liz, thank you so much. That sounds very interesting, and I'm sure we're gonna learn a lot from you here, from all your varied background during this
Thank you.
presentation. So thank you so much for sitting down here with me today and chatting.
Sure, thank you.
This presentation, Balancing Beneficence and Prevention of Harm When Caring for Pregnant Women with Substance Use Disorder, is part of the Gold Perinatal Online Conference 2018, and the presentation will be live on October 15th. For more information on this presentation and on the other presentations in this conference, please visit goldperinatal.com. Thank you all for listening. Bye bye for now.